Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Lansoprazole. Its brand name is Prevacid. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only, and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find this information to be valuable, please consider leaving a like on the video, as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how lansoprazole works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe lansoprazole. We'll then discuss examples of dosing, and then stick around to the end where we'll talk about side effects with percentages. So how does lansoprazole work? Well, lansoprazole is a gastric acid pump inhibitor, also known as a proton pump inhibitor, or a PPI. It blocks the final step of both basal and stimulated gastric acid production. In terms of indications or reasons we would prescribe this medication to a patient, we may see it used in erosive esophagitis, as well as gastroesophageal reflux disease, or GERD. Patients with Zollinger-Ellison syndrome may use this medication, as well as patients who have a duodenal ulcer or a gastric ulcer. With respect to contraindications or reasons we would not be able to prescribe lansoprazole, we simply wouldn't give this medication to a patient who had a hypersensitivity to lansoprazole or any other component of the formulation. Now what about dosing with lansoprazole? So in the treatment of gastroesophageal reflux disease, or GERD, we may see 15 milligrams orally once daily for up to 8 weeks. In the treatment of Zollinger-Ellison syndrome, we may see 60 milligrams orally once daily, or we may see all the way up to 90 milligrams twice daily. For the treatment of a gastric ulcer, we may see 30 milligrams once daily, again for up to 8 weeks. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using lansoprazole, so I'll go over some of those here now. 5% of patients may experience abdominal pain, while 1 to 5% may experience constipation. Diarrhea may happen up to 7% of the time, and nausea may happen 1 to 3% of the time. 1% of patients may experience a headache. Now, some more rare but serious side effects would be interstitial nephritis, Stevens-Johnson syndrome, or toxic epidermal necrolysis. That's all we're going to talk about today with lansoprazole, or Prevacid. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.